competing for health care dollars. A Fort Wayne senator has authored a bill designed to ultimately cut your medical expenses. Fox 55's Stephen Walker joins us live from the Allen County Courthouse with our top story. Stephen, explain the mechanics of this.
Yeah, Tara, I spoke with Indiana Senator Justin Busch today about, these non-compete clauses. He says he wants to not only attract talented doctors to Indiana, he wants to retain them. But with these clauses, that can sometimes be a little tricky if, a doctor feels they should make a little bit more money or the job is not exactly what was promised to them. They can leave, but they can't go anywhere in the area depending on how, their clause, how far away their clause says they have to move away. And this can hurt their patients as well. I mean, if they have a patient that they've had for years, the patients are going to lose their doctor if they have to move out of city or out of state due to the non-compete clause. So I spoke with, Senator Busch today, as well as a local physician, on what eliminating the non-compete clauses can do for Hoosiers. Senator Justin Busch says eliminating non-compete clauses will motivate employers to maintain high standards and make sure the physicians enjoy their jobs.
They don't want a toxic work environment, right? They want to make sure that where they're working is they have a high job satisfaction. So I think when you increase that competition, they know that they also have to treat those doctors well. And like I said, most of them kind of talk about that culture, and pay is certainly part of that. But make sure that those physicians want to stay there.
With non-competes, employees are locked in. If they leave, they can't immediately start a new job within a certain distance from that hospital. Dr. Matthew Pflieger says this allows the employer to almost take advantage of its doctors.
It's extremely limiting for you, and it removes all of your bargaining chips from the table, which, that's not good for the employee, right?
Pflieger is an independent physician because he didn't want to deal with the non-compete clauses. He says they hurt new doctors who are fresh out of med school looking for employment, and they may not know what the contract entails.
Now they're stuck. And so there should be some better protection for, a lot of these newer providers coming out to help them ensure they get a position that's good for them and for their patients.
Patients can also be affected. If a doctor leaves town to abide by their non-compete clause, they could lose all the patients that they've been treating for years. Busch says this bill will help keep those doctors and allow them to keep helping their patients.
It's about us trying to make sure we have those doctors. The shortage is already happening. The crisis is only increasing. So how are we going to fix that problem, lower the price of care, make sure this is patient-centric, and allow you to keep your doctor and have that doctor-patient relationship?
The Federal Trade Commission estimates that eliminating non-compete clauses would raise physicians' wages by over $300 billion nationwide, and it would also lower health care costs by about $148 billion. And since this would encourage more competition, hospitals would look to improve their facilities and have the best work environment possible. That's why Busch and Pflieger say that the hospitals, the patients, and the physicians, eliminating the non-compete clauses would be beneficial for all parties involved. Live in Fort Wayne, Stephen Walker, Fox 55 News.